It's clear in the world today that an infection in one country should be a concern for all countries, because that infection can spread around the world very rapidly in humans. Humans who are still in the incubation period of disease don't even know they're infected, hop on an airplane in one country, hop off in another, and become sick and have the infection in the new country. We've also seen how infectious agents can travel around the world in food. We've seen mad cow disease here in the United Kingdom, which then spread to many different countries in beef and beef products, or in live cattle. Sure. We've also seen how fruits or vegetables can be infected in one country and cause epidemics in others, such as it happened in Europe last year when an E. coli organism infected fruit and vegetables, which then infected populations in Europe and caused severe illness and death. Infections also spread around the world in insects. And we can see that in many different ways. For example, in the US, a disease called West Nile fever, which was not present before the late 1990s, is now everywhere in the US. It probably came in an insect carrying the disease or in a human, but then it was picked up by an insect and transmitted around the US through birds, because birds are the reservoir of this disease. At the same time, we see what's called airport malaria, which is malaria which occurs in people living near airports who have never traveled, but who have been bitten by a mosquito which came in from a country carrying malaria and infected those people in the country where it hopped off the airplane. So we see humans, food, animals, and insects carrying infectious diseases around the world.